Ninji esan se kwesi da bi ede kwesi da bi ye eniji kwesi da bi nso so eye guy na wa wonim se ye de dwumadi ato ne din se abrabo mu nsem eno na 5 pm bia no ye de ebe down ti wa join ye ya ha eye Good Morning Holy Spirit studio makacho se eye one of the finest ebi eni bebia eno ti yenko Facebook eye Rockies TV Obasoa no wahya ma ehia ye pa hya dwumadi no emaye na afi enso so wo do comment enso so aba wo likes enso ye hia sa enso so na ye streaming live ewo YouTube ye Rockies 1 ewo so ba na wa subscribe amaye ye so subscribe maye se na be ya ye the video bia ba one the first person on sa ebeka eho no so so betimi ahya dwumadi no afa na wo do comment enso so aba na wasa I like dwumadi no enso so ama emre semu no the international hosts abi mekan o comment na de baba mekan ne pepepe na mede amount enenso so no nyame aje adom ai menya me sister ewo hanom oye beauty with brains nyankopon ede ni nyina amano na onim bibi hwese ye ka be ma ho be ma ne obi a osipi ni wosita enye be ma ye kan ya na wasi ne tiri ase na anim ye papa no mu bi ye ma me no ye nua me ma no mu bi bisuafo ni bi obi wo hodom a owo haw se ontimi nko ahemfi nanimu ana ode akɔhye efie abaifo ana se ode akɔhye adwuma bi a wo yoso double na me boni bebrebe ni nti wo hodom a na adwen no ayemre afei mintimi nko ahemfi obi nso so wo hodom a wo se eya na mesisi ye me yenti no mintimi enko me pa chow me nua be ma me papa me wofa wo haw anti ene nyame ahyehye me sister a wasua de akɔ animu a ene no oni ye betwetwe enkomo afa emema mmerɛ ho broni ebeka ne se erectile dysfunction nti obekire ye de edeba to say the causes and answer ekwan a ye befa so a ye betimi asolve sa issue se wo bia enu nti no wo ye be ma na waso ye nsa your bass so and was okunsa na mwashia yen ewo Rockies TV and answer Rockies 1 na chese ye de enkomo twetwe no ahihye so ntene me nsem no me guest Mrs. Abigail KYEREMEH auntie me ma wakọ aba stronko eba abrabo mu nsem edwumadie I hope say bibia abokọ de yede nyame ase yeda ase so say yeto nsa frɛ wo nso so no waba o be grace ye show yi nso so amaye nti nyame enhia wo pa but before that no me pese me congratulate you because why are there dodo papa because being a mother na o say ko school no minim say enye easy kra ofa buka na we de ka ba ni nyina mu no watimi afamu ena nyame nso so de wabedwan minim se enka wa minim se nyame e de wo bekọ achiri o de wo bekọ achiri epa enu ntina me kosoa akai wo se me so ada ma join yen yaba life nti join yen ne betie because they are very educative bra ne betie bi na daachi bi no wo hu se be ma ne pen no enka na chese wa hu se say na yen sister abi eka ye enu ntina wo se me so me kunu nsa na me de ne ko hu doctor and said me came see Rockies TV na we share na say ye de enkomo twetwe no aisha mesa ma wo akwa babim auntie it's just a brief introduction about yourself obi a wo show enkofo pese omuhu why name Mrs. Abigail KYEREMEH
inti ye frame Abigail KYEREMEH me fie din de ejewa eno ana dodo na anim no enim say ye frame me a family nurse practitioner, which means me share from birth in Kwalaya warm for Frokopim in Kokra for. Right now I work in a walk-in clinic in Parker, Colorado. Yeah, that's a little.
Oh, okay. It's anything exciting about you? You perceive you. So because me say enkofo binum nim say oh auntie a nurse practitioner, and unti aside that no. Me fa ne say obetimi ahye wo krom kra amaye abusua kakra che don't go deep kakra bi
nti mawari na me won kwala too mama too baby am free there kwan wa asinfo
yeah ye faka ye bedru
asinfo
ye faka kwan ye bedru
nti something interesting about me nothing really. I'm a very introvert person. I like to be
Introvert no achim kakasa na be.
Me you be a me shada mpakasa sa.
Okay.
Me kasa na just say me are very comfortable with you. And me shada mpeni pe mo ade kese sa na meti.
It say na de adom bi na de wadru a wo say. Say no sika na say adom bi na push wa na de wa bedru a no say. My yenhwe school ne kakwa yenhwe challenges no. Wo say me di kan say I was may congratulate you because why you are dear pa because e bi mo hono ma almost start here enu baby no because enkra be ka ho a enye easy imagine say adwen no kra obede na wanya kra na wo de ade akosua ade but ni nyine watimi afam eti ye fire pass you through family life no balance that with education no say na na city
so throughout my whole life you know me work Ghana even though nursing wasn't something I wanted to do, no. Me buy krom ho no said the over beton no the oya no na oye bi. So me buy and my sisters were into healthcare. And then I started as a caregiver. And then I realized I like, you know, me penipa ho adwuma and then I went to school, got my bachelor's of science in nursing and then me adwuma over 10 years. And then during that and then I realized say only doctors ye adwuma and yet, the Omokina, I say, oh, you're nurse, and nurses would understand me. Omoka, I say, you doubt that, Kakra. And most of the time, you know, suggestions, and also most of the time, you know, it seems to be a better option than some of the providers. And once I suggest and they take it and they implement it and it works now, I feel good about it. So I thought, say, maybe going back to school to be a practitioner will be something that I enjoy. And apart from that, and I like the autonomy, say, I am making the decision myself, not depending on somebody. Back to grad school to become a nurse practitioner, it was not easy. You know, it's doable. I mean, obviously I did it, but it wasn't easy. When then kwala mususa school, so full time. But so I had to sacrifice. Me made me sacrifice you know. I had to wake up because during the day, you know, my life is busy. I'm working full time during the day, and in the evening I have kids to take care. Now my day sorry how much that is I sacrifice my sleep for school.
Okay, baby, now me interested, but we'll see. Although say na onye wadwen say obey nurse but obey na wonuamu wo mu dada and na o start as caregiver na che say no find it interesting ehwe to say wo ka say abey trend bi e wa say into wo be advice wo bi say because say e trend into no obi an follow
enyo bia on say Ghana na nya Ghana for within the African community no amount for fee say nursing is kawum. I mean, it's a very rewarding career to have. Don't doubt me. I have some few friends you see, so you know, your babu chen yes, you say 119 you see, so you wanted to be nurses. Some went in because of the money. Now they are not doing it. You know, I have a friend. I'm in a graduate from college, or you're a registered nurse, but right now on farm practice, and see, it has to be your call. It has to be something that you enjoy doing. Nursing is rewarding, yes, but it has its own challenges. You know.
It's nice a dear no a scanner and let's be honest. A scanner and answer a passion. What they because I'm poor because they don't make us a chroma saying stress and so be answer okay. Obe kwa juma full time waba obe shem kra na when na your but still was say your assignment we take some notes in the day it's not just say nurse person just say ye we na for say be a passion into na we na say
it has to be a combination once it's school no boarding what I say into say Oko school na say ubewie na wonye adwuma what is the essence I say ebi more to me I mean I'm not trying to judge anybody ebi more you're into music you know and you talk to young kids I want to go to college to study music I mean it's great that's what you love but what is the job market after that and see me thing is say if you have something that you enjoy for example music if you enjoy that you can do that as a course but you have to make sure say you are into something that will also generate give you a decent lifestyle,
okay.
you know, afterwards.
Okay, na me koswa akaiwo ese yene Mrs. Abigail KYEREMEH na ehia wa hase ayetwetwe enkomo about emema emere broni beka say erectile dysfunction enunti no sa afi na wo join ya me so frɛ obi na munhia ye ewo Facebook Rockies TV and I say YouTube Rockies 1 never betie efutu na onso so efa eto ABRABO akwantu ene so iti Mrs. Mesa amawo akwaba ebiem Mesa amawo akwa iti yenhwe the challenges involve say bia wadwuma ya wo ye as a nurse practitioner yenhwe challenges ni bi.
So one of the challenges is say things changes all the time. You know, Americans there's research going on. You know, a drobia first na ke treat ya we be no bon say all of a sudden narcissa. Into that is the challenge. Into even though we be school no, you are not done studying. Today you have to be up to date because yes patient be about on chain or because you be like, oh my God, what is this? And so that is
it's not just say osa go through training.
Yes.
Na eno ne be wow personal training and I say adwuma na you are involved with no or man do be pass through training no.
I say oba as a provider no. As a provider no we have something called CMS, you know, a states no requirements say after 5 years you have to learn a certain amount of things for a while. After 5 years now say when you have those credit hours now then you can your license cannot be renewed. What you have to learn is up to you. Into say be our primary care like myself now then what you learn is primary care setting or acute care is a hospital setting and then what you learn will be related to acute care setting. To say Nancy COVID abaso into most of the interest is into COVID education, what is going on, what some of the adverse effects, you know, so stuff like that is what so does it make sense?
It does.
Into the states require you to have certain hours of education, but the specific of what you, the specific of the education depend on you as the provider.
Mati say you see nurses and yana bebrinata enya mental you can say health problems. And I said because of stress and burnout and internal bebrina and they have to be in the situation almost young one day na or more boa say and benya solution to their problems now due to stress and no near you know any your friend is say problems are issues be on man for efemono a bit more and they have to be like those people now they are trying to save and also wadwinche won to say
it's always easy to preach than to practice.
That's true.
You know, I mean, cardiologist tell patient don't smoke, but we chain smoker. You know, it's very easy to preach than to practice. And you know, stress involved with the work, you know, like I'm saying, or clinic they have a certain amount of patient you have to see a day, you know. I had a friend who worked in a Senate clinic at CCI with 300 because the demand is high, you know, and see, if all this pressure is on you, now we need good, you know, coping mechanism, and then you end up doing other things to make you feel good.
It's not just a has say no and a passion and as a call no come to play because they said they're okay. It be an man may go in for money no. Na enya dia eyema komema dia me pese meye so what I say eti eno sa no so passion ne crampo na wonye wuramu a niema na ekoso nyina no you wouldn't mind and I say you wouldn't care but so different motives say me because of as Francis Canada dear. I want now say pressure na ba fe na wo pe baby afa. To say you made mention of COVID by. The way our encoforce stress say frontliners, doctors cramp do baby cry na omo nsem aye de ebu because na omo nhu baby a researchers no cramp na omo hu kwan a omo mfa so krom betimi solve sa issue we. Nti God being so good e janyame ya adoma yenya vaccine bia so no but no cry no so no dear but enra cry. So these are some of the my friends say challenges ni bi so a enkrofo fam to obu o crampa because of COVID e ba e cry enu nti amanager na djuma or yes onti me career we ntiti no or ye den a friend say wo kwa akoye adefofo meboa okay iti no yema yen topic ne so me hu se enkrofo asoma ye omode mo pese ye ba topic ne so na tese kaba ye bi ti time kakra me pese enkrofo aha iti abi ye erectile dysfunction saying ena osi etiase si fa say na obesi a church adofo mu a omo ebetiase
say you can erectile dysfunction bema sebi ne bema no entumi sorry for penetration ebi mo so de ne sorry entumi it's not hard enough for penetration and then you can erectile dysfunction that being said no you can so be infertile you will pre
okay.
And those two are different things. Even though they coexist, it's very different from erectile dysfunction.
Oh, okay. Into person chese obi wo ma ade no sorry. But into me nya adwuma na bi also a otimi kwa animu but sisi a na wajemu nyesa na person che.
And they premature ejaculation. When say erectile dysfunction na ye be ma na hoden.
Sene ebesia sorry ebe
ye den no ebe ho sorry a ebetumi ebi mu ode intumi sorry cry ebi mu so ho no ma sorry but emu nye den enough for penetration. That is erectile dysfunction and no so a omo ne oba da enche na omo ho aba no and so a different area. But I wanted to make it clear say erectile dysfunction is very different from yes.
Okay. Is it normal say ubenya sa issue erectile dysfunction normal?
That answer is very complex a little bit. And you're normal. First of all, and you're normal. It's not part of aging. Actually, there are people who are in their 80s that are able to function normally. But erectile dysfunction is very common among men over 50 years old. And that being said, on say wuni na say ya rieni nyoma ba. Inti e be man yes said erectile dysfunction a normal thing, but it's not. It's very common among, like I said, men who are older than 50 years old.
50 years and above.
50 years and above. It can happen. I've seen men who are in their 20s with erectile dysfunction, but it's not common, but it's very common among men older than 50 years old.
Okay, your babies have said a dear contributed to erectile dysfunction. Causes may be a thing.
Very broad. Say a be say be a bear a be a wenya accidents. Someone was spinal cord injury. Say be one ma a be a car accident and I say or teto free abonsance robert form tinabia will ne spine. And any injury that occurs in the pelvic area, to say be a prostate issue, and yet just prostate enlargement, maybe one my prostate cancer, colon cancer, all those diseases that happen in the pelvic area, say be a nipane get treatment like chemotherapy, radiation to that specific area now. When you're like here, it affects the nerves connected to the penis, It's not ma no I say engagement. I feel you're able to say diabetes, and that being said, diabetes very diabetes our chance of getting erectile dysfunction are very very high. What you remember with the 100. ebejina honoma obetumi aka say 30 to 50% of those we need 30 to 50 men. Efrema, those people have erectile dysfunction. Into diabetes here, urea and obema now will be and yes, diagro because they're very risky. Usually, I tell my patient that, and my cophobia. I'm not trying to be, prejudiced, but more down and for more health, seriously. And once you tell them the reality, say, what diabetes are, what chance of having erectile dysfunction, they become, oh my God, I need to take this seriously. See, diabetes here, a bit to me, erectile dysfunction, or your bema now cholesterol or high, hypertension, or wakumayari, a bit to some more neurological issue to say, Parkinson disease, MS, and Alzheimer. When say you can't Alzheimer, ya age with seniors, peno, obefi say Alzheimer young for area, but it always starts with dementia, in the younger people. And see, I say, Bermano and Chenani Refi in your man kitten. That is how it starts. And the brain connect to
not just a brain on brain come on the said kind say if you want ma adreno it's me affecting ne penis and I say ne bema so na ye duane die ne so e because said they work at diabetes now then say now boils down to aduane a enipa so edi because last time no cause I now say a holiday like on shut down go through that but I think say will beat me on my ear idea kakra about your friend say near member so dear it to me to resulted to erectile dysfunction because what the can say accident quite in me ediba and now we diabetes now can add diarrhea so mean says and many na e be so connected to your DNA yedi it will be to me I enlightening on DNA area no so kakra
on say your DNA no we penya said we meduane ye na meduane nye to say junk food na de bia with the fries Burger King those kind of food no increase your cholesterol level and see any aduane a wonim say ofie to say go aduane bebre to say beef nnuane na eta ye de no and then eta de nsem bebre e de braye and see yeah and I say bia diabetes and so usually calorie limit. I always say woody. Inti say as long as you be follow the doctor catch no, you shouldn't have an issue.
We say yeah Africans na dey what say e basa ho na ye mayani na ho. Eduane say ye fufu ne banku ne ye inde che say ye ni bi kura da kura. Obo mo say wandi fufu na ye say ada no wandi. So, it's not just say, no, you bet me up a crumb, you bet me a consuming those and a day crampo. Say it depends what health condition I wore. And Cafufuni and Kenya bone because a carbohydrate. What you say, but so you'll be our diabetes, then it become an issue because the say a starch. So those turn into a carbohydrate and then it turns into glucose in your blood and then it spikes your sugar up in your blood and then now as I say in your it's all depend on the chronic condition or what it's or the bed na say okay it's near the greens in the sweat you say green foods na say na your advice say no so you're very good for your health. Yes, yes. Ne papa mu di anka yesa salad ni yedi. Enso bebi a ye free no. Enso I say we di fufu kra we di salad kan. In fact, me tell say na ma shrimps salad ye di fufu ye dey friends fufu kan dey. Na wo ye ne say odi wie na odi. Wo se da bi otwetwa gu soup ni no say. Sani recipe ni the way obey ni bia be ye bia na ye ne say. Un say ye bia ye free ni salad ni nka eduane a ya nanamo enso ya nanamo no mutume ye kontomre nti betumi aye kontomre froye but body bia mi no pe instead of say body bebre ni kontomre kakra bi no and you achieve the same goal. Instead of say the tide of salad na be yeah, what green aduane yeah so you betumi yeah it's healthy
yensu ye kon bedo ho se de won kwan no se ne won kwan no bejwetwa tomatoes bebre egu ene de ye wa ene de ye wa
you know so contomre ne nko aso e.
Oh, Sani, are good?
You can contour any bit to me. I replace salad.
Oh, yes, definitely.
The normal salad,
yes, definitely, yes, yes.
Oh, okay. It's here. When should a person be concerned? Say, Bia, what's now when we say, me sharpener, just say, me hear me who she I need. It's a time, bang, and I wasn't any pan who say, there be a mere way there was some rush cool doctor. Now, your friends a doctor to me attended to this problem. One
say about erectile dysfunction, a man no betumi a kasa same way ye pa because one say psychological and say be I won't know you muntemonye and that's environmental stresses, you know, there be a dream problem or whole baby how, you know, all those stresses they were honoma a be a or ye person who diagra or yeah, I'm sorry. What you say? And no doesn't necessarily mean say you have a problem, but say be a everything is fine at home. Any jail or no na say or banned on who can't send your man queer. Then I think say a so-called doctor. On say erectile dysfunction, penis nankasano, a vascular organ. What you say? It's kind of related to your vascular system. Wakumano, the way a function is say ye papa or bear man so be your papa. What you say?
Yes,
and a command so can. Nti a moja say be a ye nipa ope and waiting any day. Now atherosclerosis in your wakoma. The chance say you will also have a plague around the veins or arteries going to your penis, you know, and so you hide. That means say moja into me rush through the penis for it to erect. Inti a issue was say what they come out with doctor right away and you say idea was say what's now and usually say maybe what erectile dysfunction a be what honoma your warning sign to them say they're about to have myocardial infarction, which is heart attack. Into something that you shouldn't sit down for too. Yeah, you shouldn't take it lightly.
Oh, okay. Who can be about say will be called 20 years any panel 80 million sa issue. It's here 20 years a day. A coin being because a accident now when you accident to crime fuel. Aside accident no. A coin baby will be all 20 years there will be mania sa issue we see.
A bin assist ya make us say be a war plague we say a war angwa me hu the way I make to say cooking oil I say angwa na da wo veins ne ho a nti moja ne into me mfem e be ho no a osano ne lifestyle no smoking nti ne arteries ne I block ya constricted e be ho so a yare to say thyroid, you know, what thyroid issues, so it can also affect all the thyroid no organ dey we have, but say what thyroid hormones ne were higher it wasn't so and so emma the whole human being and it will learn so e wo eno anso ne sinsan so emma
inti not just say e was say enipa bo modern na ye tire test na
paper trying
daily checkup and chairman ho nya wo bia and I said baby afa kan was schedule who say this time we say there was say me ko hu doctor.
Say America hana ye wono things are easy for us. Say on my share in insurance requires say at least once a year. I so ko hu doctor. What you say? Omo chronic condition no. Obon say doctor na make sure say follow up at least every 3 months.
Okay.
But so you'll be healthier at least annually. I was so cool. I'll bet you moja, I'll bet check you and make sure say in your mark emma.
I don't form fan chain to more my bass on scientific terms, no. A dozen to me try say a become natural say, my sister to me are breaking it down on my senabeja. Also, scientific terms and wouldn't him send me on tea. Na chess what to me I know what to me me. Yeah, what are some of the possible interventions was I issue here? A bit in your boy was solving.
Say to say the mechano, obi wa erectile dysfunction, it's caused by many other things. Inti ansa na doctor best start with drokra no be show mojim or be examine from head to toe. Sometimes you be draw naked ni ahwe say or genitals no how does it look? Is everything okay? The we are enwine funo is it normal? Scrotum no bibia okay? Reflexes is everything okay? Now I show mojim say be our diabetes or anemia, because sickle cell anemia patient can also most of the time have erectile dysfunction. See, omo training na fe omo treated the cause. Erectile dysfunction can also be a cause from medication, side effect of medication to say or anxiety and depression. So it drew be I did treat you almost even it drew I did treat hypertension. Some of them causes side effects in the year, se beman and a beman emunya din ye. Into first of all, say example say a year drone e be a wofa na cause sana. Obon said doctor no, e best say drone na ma and so be ye through ho. Bon so ye through e kakra bia na bibia cause fine. Say be a year e be a cholesterol e wo sra or do be to a draw so. Na nyoma akoye say ye what thyroid and so or do betu edru so na nyoma ako nti na chese we are solving the problem to make things work. That being said no sorry that being said no that being said no eba edra ye dey treat erectile dysfunction na there were multiple steps. Say the first step ne a pillar a man forever, and the most common one a common no to say Viagra and Cialis. Okay, those medication fano as needed. To be fano 30 to 1 hour time before.
Okay, me man few men now they are no more. So now yen guest enum nsuo ne me fasa akonya we so amadofo bi akwa ba ma join yen Augustina ochre ehwe yen ye cha tando ehwe say good job and journaling enso so ehwe mpacho na mo koso ehwe dwumadie no enso so ema yen na ema obi enso so emra so Facebook Rockies TV obaso ana wa share sa so na YouTube enso so ye stream live Rockies one say na can emema emreyo when you beka say erectile dysfunction intino de edeba ekwan ye befa so a ye be solve sa issue we say no say na me kan na ye guest ye na wa ye Mrs. Abigail Kyeremeh or ye nurse practitioner nti ono na won educate ye wo sa ekwan ne so anti mesa ama wo akwa babim tina to aso wo baby na ye can about possible intervention.
Intina make say e wa America hano the common medication I mean a man for who no TV so say ye Viagra and as Cialis, into those medication or more fun as needed when we say be obedi agro bia no afan about 32 an hour time na wa fana fe wa man no time na fe enyoma koye amano Cialis no it to me stay in the blood for a longer time. To say Viagra will stay in the blood for about 8 hours.
Cialis no see a medication.
A medication. We say a group of medication you find PDE 5 inhibitors. And see the common mabu be actual say Viagra and Cialis.
And also okay a meme bua for so. Viagra yeah okay. Yeah. And also na said your munya. E bua mona as I said your munya.
So yeah, can you? Sir, me feel so yeah, can you debate me a treat?
You bet me the treat, yeah.
Yeah, into make us say you treat the underlying cause of the problem, not a still problem no honoma. Then we have to come to medications that will help. It's actually intended for that erectile dysfunction. And I make us say it drove it to say Viagra no or far be man be fano. About 30 to an hour before, I grow on a babasono. Now Viagra, for example, will stay in the blood for about 4 hours.
Okay.
And see, and you say be a fire, and I mean those men who use it know what I'm talking about. And yes, or fire, and I just say, I baswe say when you stimulate, or Barbie, who Barbie,
not just was so more,
na and your marco ye, and another thing about another medication, Cialis now, it's not mujan for a longer time, up to 36 hours.
Okay.
And see, I know son a bear man found one day, I know just say it's not a so dear going to be so fabium. That being said, because say it was a longer duration in the body, no, some providers the memo war erectile dysfunction issue ECB at the umber to low doses so fan on PBR regardless. In no a ma sexy spontaneous and natural instead of say beer or your person no dear girl say train 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 money more natural.
Okay.
Say ye de a drone mount nasa nye because usually it works, but I know be an bono.
Okay.
And see no na then we go to the second step. Second step na ye a be a vacuum, you know, and see vacuum no one say bear man or the best ne bear man, you know. Na I say pump na say or pump it.
And see what you must.
Benedict.
And to say no one by an answer and answer
any day depending on one. So one for year be more yeah, so fair so ana.
Just a woman a crab and answer day or prepona mana be eduma yesa.
No Benedict.
Hey, eduma so Mr. Mama so na en common insure Priscilla say I'm watching from Ghana. Nana was a good topic. Oh, okay. Now, I did the question. I was can stress cause erectile dysfunction? Will be question now, or the buffet you can say Facebook and so on. Was can stress cause erectile dysfunction?
Me pa try. I know na me ka say ebi a fie nyoma nko yi abi a wo yire no ho ye we and I say me was stress. Environmental stresses can affect, you know, it's a brain thing, you know. Into say stress or honoma and even ansana be my back clinic, like I say, this is my issue, you know. Yeah, what questionnaire you ask and making sure that this is not psychological caused. You know, to say psychological na it be a tool for clinic na far, then we will send you to a therapist. I a psychotherapist or beboa now making sure say psychological in what dream we are clear to make things work.
It's in the stress now. I who say a man ye major contributing factor because okay or baby one man is a wo stress we kuna ontimi nkwa ahemfie anamebwa o ma ne fa problem baby ba ontimi nkwa ahemfie and they almost so no omunya de pa na o man ko stress mama almost so no ene ma bia anya adwuma na mboa na say ye ka ane aka ahanum say so anamebwa it abi yen hwe te say wo de a wako medical side no so wo de no ye scientific method it yen hwe almost so a omo use the natural remedies say ye bibidro ya ene Ghana kra de oko YouTube ya che say we Canadian na we Canadian obia wane de ode ba hwan tree ebi kra ye cocoa powder yi ebi ma ye in different forms yen compare scientific one no ye broni die yi ni nro ya wabobodin ene yan ye bibidro yi then I feel say very effective ebetimi aboa with such a problem
ansana ye beko ebibidro no ma menka
okay
Minken we na the interventions we have here in the United States and sana yaba before drone into said me can vacuum no until bon say pump be or the sha no ana or pump be man na yeden no way you vacuum no na fe or the ring no ashe the base of the penis you know and see and then it will be
base in a year and no
enye shaft enye anona Johnson Fumobano
estrono
a formono
oh a formono okay
nti eno na be holding and maintaining the erection for penetration once a grown baby and mo yi ring na then everything is fine. Another intervention is second step cream ebi mo ye cream amodefa be mana nano and ebi mo so tube baby a Johnson e free no wo de be him na bia wa pump e drone egum no e drone na mota de fa no ebi wo ye adwuma but its effectiveness is not as strong as the omode tube no omode him no ma pump e egum so pump egum we na bia wa na say wo na whoever you are with that day no a massage na fe emu aye den ama Into first step, second step now work here, then we're going to, you know, aggressive intervention. And we surgery. Surgery and a bit of honor said me as a American, a bit of honor say be a plague here what arteries in ma. Nasa we younger, you know, to say they make 20 some more young, we healthy, won't smoky, we need diabetes, we need other risk factors. Then the doctors will try to bypass, you know, maybe as a clot tonight, mojan to me from normal criteria bypass, and I say moja film. And I know you're one of the method used for healthy men. And I in kokra form so any na ye artificial, you know, penis. Multi create yeah, I'm offering prostasis, you know. Mode shame and on no bema to said you know about or per se when ya or implants, you know, what to me choose to say be a opekese, opedie, a wa, opedie tre, over chances, and it works, you know, a bit more crowd or banning and feeling any difference between the natural and artificial one created for the man. And so I know the intervention what America has been approved for erectile dysfunction. And so now let's come to it works. Surgery. Yeah, it works. I mean, surgery has its own risk, but it does work. And actually, people prefer that more than other things. You know, to say, in Abakubi, I actually forgot. It be so yeah, injection. Okay. And man be more. I won't say doctor nebe a pre-filled medication. But send you drone and a pre-filled medication. A pan or the one the bear man give it few minutes. It won't say na a juma. And those men can actually have multiple sex because some who background it doesn't relax. To say they are natural because say the erection is not caused by the nerves, surrounding nerves. It's actually caused by something else. Because said they can have multiple sex, they also run the risk of having priapism, which is longer duration of erection. As a bro 4 hours, it can be serious. You need to go to emergency room for them to reverse it. How?
Reverse? I did not say reverse the same.
Panie, but one on my train, moja.
Much moja nefu, not just say ayewe.
I call back to normal.
It's not just say interventions now okay na the surgery na it mean last year na.
Surgery in a year last result. Once surgery is good, but it has its risk. And then you'll be on a pulley show. And see, they will try all these things. Sending na far then. The last results will be the surgery. In the so ye bear man I say be a nyamia domonaso wa America na so erectile dysfunction and ye be I will say or ferry home now because there is treatment
ye beba hono na yemra eyiro question am be can be about natural remedy na so person wie we na answer ya ba ehonom no it yen compare scientific method no ene yan kasa ye fe local one ya enemy and we and Crawford you say a bim would am pesaja TV soon to the members my body and a bim would I shall that they are tona just say yeah young advert and nipper to gusu young share and also so effect a woman now let's look at the difference first young compare now you heard the effect and also
on say a baby draw a draw be a mishadan name casasa on say oba cabro for drama me to me aka we many so baby draw it probably works, but unfortunately, yen and no man shadan fabu to ho. Or man shadan systematic studies say nipa we fine and yejma. A yejman swa after a while no, this was the side effect. On say you need documentation to me boy and say oh far this is the risk. That is the risk people take when they take ABB Drew. To say they make Viagra, so we offer Viagra, and sana offer Viagra no crano, and sana a primary care provider. A psychiatrist say take this medication. Most of the time they will send you to a cardiologist. A year specialized in the heart. Now making sure say is your heart able to take this medication, or doctor and so be show room I'm making sure that there's no contraindication with this medication. Because, for example, say I was taking nitroglycerin, a drug amount for chest pain.
Okay.
If I want to Viagra, so because of blood pressure bed drop. But when I say, wait, you better man answer and so be. What I say? And I may be a drug for prostate. If you want my Ophabia, if I want to a drug so sad to say times low sen. Or far and only a drip to say Viagra and Cialis. All those medication will drop your blood pressure. Into sign your money bina a baby draw any data for that. And again, a baby drama, what is the effect on your kidneys and your liver? We don't know. Okay. And see, Ubahu say Nipano drone, so all of a sudden I say wakwenya another condition. And I be draw me say I'm why I'm to be African market.
Papa, you be dino so online. Yeah, what ent didn't bo I mean to me more. But you didn't bo on the match and say, what's it dinner? What's in who say? Me toa ebesa me yare amame.
Inti I mean it's over the counter. African market no say obekwa akoto. But I had na prescription and answer a doctor then a pen basis so atramon. We making sure say how. So doctor no cry mistake a pharmacist no backup or check ya making sure say there is no counter interaction with your medication. Is it safe for you? Lack will be true. Okay. To say the mechanic see a baby draw. That is my only concern. We will honor my memory be a very stubborn. Instead of so we call Doctor Hono or Casse a baby draw na mafada dada.
But I be musu.
Yes. So into so to say me media me futu me de bema sa bema and say at least my doctor who said this is what you are doing. What I say or doctor knew who are obetumi aboa and make sure so or check you mojima make sure so all this medication doesn't have any implication with your kidney or liver. And I say these two organs because those are the organs that usually excrete most medications, Inti o doctor at least obe check onimse fedro bisana obe check every 6 months amount and make sure say bibi akoye afen so obe check wa come make sure say is your heart able to tolerate all these medications.
And for the questions afa Facebook pa se mimbisaw araba edu a good job, Sissy. I think so, sister. Was sure, pa. Or Sibi Musa say, how can wives encourage their husbands to go see their physician to discuss this issue?
Unse, Bearman, Kuya, a how ban so. What's I say? And I feel Macase say. Usually rectal dysfunction and you're normal. Usually there is a disease that causes that issue. What I say inti and no Emma and she like and no encourage your ban say even say if it's not about sex or anything what is the health of my husband? Do I want to lose him now? And say fanoko and I encourage you. So dear, so fair my young check is so wakuma ni yejuma. Mo thyroid or diabetes is everything under control.
Nene wo was certain bia wo examine na wo oba no. Send ebia make say nye da bia na ebia wo no kunu be hia. To say bia wo pe wo kunu ye na was certain bi wo ho a wo koso so mu hu say.
Oh, so we already
yeah juma na say it's me quite dimu.
So we already stabby. Why worry? Into when they making.
Oh yes, minna.
Inti, I mean, when you say yes, be a 1 month now won't call. What you say? Inti a idea you would know. One say be a honor my baby be a hormone so issue now percentage be.
Yes.
Inti I know son I say or no issue yes or no one to quite be.
I dear any before crowd no
before because on percent will be home. It just take a knowledgeable, wife and a or drink which there should be some because more worry and I bear man I grow with deeper. All of a sudden I say why and who said it on pill be I said you just have to discern and then figure out what is going on.
Because a money being so on the mount or mukruno fast was our problem say now. e mani bia da ne by force nurse so wo mo atimi hu se ada bi me bon katen kwan na me hu se ade ne betimi apawa me boss on o mo ankasa che that na se hu se on call hospital but ono atimi e hyehye ne kunu nuane e ma no aduane ofi se e betimi aboa na ma ayede aye job because ya me hwehwe okọ YouTube nim ade a mitimi hu e mani bia like omutimi yes I was ebi adi aduane we di fruit obejutwa fruit amani kunu ne ade it's like oba agree and answer would you say the right process say we say manifa so ohun sa problem na so no ankasa onko baabia na no ankasa ahihye nuane e wo so de mani kunu
one say again it comes down say I mean nurse that's the difference between nurse practitioners and
nurse
medical doctors. You know, we always try to health promotion. I'm always going to say erectile dysfunction is not just about sex. It's about the whole being, about the whole physical being of the man. What do I say? Into bemano and soria. Na so fi say aduane bi na wo ye na be ya you haven't solved the problem. Ebi aduane na wo ye and it contains some acid beer, you know, it's pumped things up. But you know, it's a band-aid to the problem. The problem is there. It's just a band-aid. Into be one say when be man to apum or die one sorry. Into say wo ye na ebo good for you. Aduane na wo ye man na say nyoma koya na jo good for you. But my education is that you try to look for the cause of the problem, not solve the cause. And then hopefully you have your husband for a longer time.
Inshira Presla, the question be about now. I don't know how this is related to your topic, Nadia. Or say, is there any medicine for women to also boost their libido? I don't know how that is related to. And your question now, yeah, but meaning say when you're joining you're trying to money kakra. Because I think say be a money bu also I said be or more libido no from and no cry to me kumbe man so na me boa.
Yeah.
Because a be man ba ho de bia na you are not interested that. E bia no so timi. Say adreno, you connected to adreno. To say onye interested that. E bia no so cry to me accumulate na eku ebia ne interest and answer it me kura ku be ma no eti yen try na ebia yen pe answer be ma Inshira Presla
on say in ma first of all yes there's medication for that usually oba say bia nya be ma no ho na ye we hia na say nsem bi na ekofie so fie busue masema you know na say be ma na jejo so you know in ma sexual being you different you know you have to prep the oba no to have the desire. And to say, Sanyo we na bibia akoso wo fie na still oba no ye botoa. My advice is about doctor, be check your hormones. How is your, you know, hormonal level? How is your estrogens versus testosterone? What is the percentage? And to be being koyi after doctor blue so it drew so na aboa. But again, it's
na aboa because anyone be one ma emma wo ni peduano crisis to say hormonal medication me say me mpe because ebi o esesa wonyema bebebe e me bi ma wo ye kese e bi ma like wo body no won feel within you sometimes e no be a year but on say ha no medication the side effects ne be very very harsh. I want here best all those say solve a problem, but a bit to me say no cry.
Yeah, internet will say we'll have a good communication with your doctors. I want to say America again. We are blessed to be in this country that we have multiple medications at hand. And to say be a hormonal therapy, for example, you are taking hormones for birth control. Not say a normal side effects, ABMA or acne, and there's other form of medication that would not have that side effect. And it's all about communication. Or doctor, and try. In fact, they will send you to a specialist to be just for specific thing like that. Normal boy.
Oh, okay. Obi so dia ba say physicians na Africans no and as nipa do nya Africans nipa no do na the reason to omuntimi country doctor say bia use traditional medicine wo the fear say bia doctor no be catch say bia doctor no be discourage and as doctor no be catch say no they should put an end to it. It is a wo na wo field ni mo no obi aba ho na bia nipa no take traditional me and say a bibidro na se for na what advice be na de be manipa no
on say doctor Bekatro say memfa because it said me kind no we don't know the studies about those medication say beboa say be say nyuma we don't know into a risk and once say obefa will be said this is my primary doctor no say nyuma be nkoye ya e be you no so ne burden into I say owoba right now two ban of one fan you know and see a bit more some patients are very stubborn it get to the point that very non-compliant the point that doctor and me I just I don't want you to be my patient anymore and see it can get to that point. And the whole issue is not about bibidrose and yet the truth is that we don't know much about that medication. And see, I can't say keep taking this medication. Next time, becheck you mojana say be our kidney function say worse. It's on me. I did not take care of you well. In Tina, I some more discourage a man for against that.
Omo ye traditional medication e bi mo so attach scientific one to it because na okwa especially Ghana say omo enkrofo a omo shada use traditional medication ankasa omo de omo si we di afa abefi enfidie mu afa eti eno sa no se nipa ne ba na se eno na offer eno so obe discouraging and answer obe catch and say ye ni hu studies intino any cancer we use it.
Once you have to take charge of your health. What I say, over clinic one because any common medication used, you know, here no, your doctor probably wouldn't know. And so what banana say there is data about it. And once I print a copy or research, you know, or doctor no or your papa or be ready. And then they will support you. That being said, in America, Hananka say will provide us doctors, medical doctors are almost a year into a BBDRU. But as a more functional medic, you're from a functional and I believe in those stuff too.
Say from Chinese for no one to tell you see Sanyo and the Chinese for believing in sa traditional holistic care.
Yeah.
Yes.
Yeah, and see America Hanon so be until you be I want we nipa when shadanje, you know, normal medicine, dear. You can go to, you know, functional medicine. The down part, and they say most of the time insurance doesn't cover. And they are expensive. And, you know, usually, you know, functional medication intervention takes long time. And it takes a lot of work from the patient. You have to change your diet. You have to change your lifestyle to make things work. Whilst over normal medicine, you just give you medication and things are going.
I be meaning so wouldn't about the insurance system now connected to sa issue you can send your family nurse practitioner. May sure say be a patient be or more issues about insurance. It say in Africa for you say my insurance in Tiniana you so say about hospital near there with this issue. It's yen share meaning so any knowledge about how our insurance no is working. Say be or what problem we say. Send be any panel say okay. Me insurance made to me akwana say me insurance grandpa kwan say na mefa so a meet me hu me doctor man aboa me.
Okay. So in America, I mean, you can always pay out of pocket.
Yes.
No burden, dear. But the insurance bit you usually say out of pocket. I won't say cheaper.
Okay.
For example, my clinic say so you need partner say when insurance, we will charge you be at $96. But insurance na nka oba honoma and KB be charge you over $200, you know, insurance. And see there's always there are other clinics a year, you know, state owned they actually take people who don't have insurance or more money in krata and everything is free. And see there are resources around that you just have to
say me links Facebook for just say masumi ya modesa just say questions and crofo to bano but a meaning here maybe suggest one question na just say yeah the interview no abewi nana do busasa was say can erectile dysfunction be hereditary?
No.
Okay.
I don't think so. Okay. I don't think so. No.
I know to say the can say
accident and I say ye wa kwala no say bo honoma kwala ne bi honoma I say nyoma enye ye enye hereditary nyoma na develop
okay
ye
or developmental delay
developmental delay say bia say be in the penis no enye ye in the scrotum na enye ye
ye na say what the new dia samaba
and to say say ebia or you chrome na say ebia sikasem ntin eno de asembeba but so chrome hanoma they always have surgeries to help so
omo betimi aye surgery na ma na be yet to say de nyame aye na
same pennyfo crowd na say nye ya ye surgery ya de implant ehim e ma na ye nti
it mean last till say we be free we ase
say a natural nti of course sometimes ebia ho beba achim you just go back and then you just get it fixed and you can use it again.
Mrs. Yeveda was Papa for this great insight. Odiama na minim sese adofo aso eye omodenti sene mosanya honkeka modi abane no next week no monsa emra sa nti no ma menchi adofo mogesi na ochri ye chan tando or say good job journalist so ehwe yen Insure Priscilla and the ebusuafo ni nyina represent na nedu enso hwe or good topic na Joseph Yeboa enso so ewo ahanoma ono so Araba edu enso so ewo so na oh okay was it to be continued wasumi order there yes afa part 2 sanfa mra okay almost here for part 2 almost time ni so ento mu hia for part 2. Okay. It's your final words na just say inclusive bibia wo adophobia obechia wo mo bibia obetimi aka aba o clinic no because ebia na ebi munim ebi musunim it's akwanya we no na chese obi a wo hwe yesu will get the knowledge and answer information as opportunity to visit you say or issue bia other than we or any other medical issue bia obetimi aba on chain for advice.
Enye me clinic na me ye adwuma na enye me private business inti opesa me for advice I'm available you know but
what the number be to join say no dey
eno dey ye visa star bi star bi de man ai
say ka say we aba say na che say omo nyina wo so sesi a ne de janka ye betime dey onsa
we just ye be share star bi ansani ya de number na but the America finally about erectile dysfunction it's not just about sex and that is what I want to keep saying it's not just about sex so ubenya if you want your sexual health to be good then you have to treat your cardiac health to be good. Wakoma. Okay. Nti o exercise here obenyi ache.
Okay.
O show aduane di mu ye a obenyi ache. Wonyi ache na say enjoy life, you're having sex for a longer time. To say the American, erectile dysfunction is very common among men older than 50. Okay. But there are also men in their 80s who Omuni issue. Inti say we take
there so cramp no. Waso where we 80 dey ahode na wa de kwai. Ti 80 kwad what's that problem no kra say dey hwe na who di
I'm trying to say there are men who are in their 80s who don't need medication and they are able to function.
Can make us come no mo time aso wi nti. Mo ko mo nya.
It's yeah.
24 na ya na ya asem o usase na wo sa issue we ya e na wan hwe ya na abrabo na ba awie ya ma na 84 ndi omo nchene boto awie ntim omo na nya de a omo nya abi wadofo bia wo be chia wo mo
me pese me ka
height na crofo abaso a chese omo ma thumbs up chese nya asem ketwa ahom keka na amon san fan share next week why
me pese me da me nuano me kun all my loved ones who are on to support me. I really appreciate you guys. Thank you very much.
Thank you too for coming to Grace My Show. Enti odofo chese me hu mo ankasa mo aka mensem nyina ma menti no me hu asem a sese no mensa akora me nkabim nse Mrs. Mrs. Abigail KYEREMEH or your family nurse practitioner and then wabe church enema bebrebe about erectile dysfunction na or can be so or say premature ejaculation no difference ewom nti say ebi a wo yi obi a wo ne wo be hia ho bantentan patro menye wa adwen say ebi a wa ade no ye yi kakra ebetimi aba say say lead to that but men fan show trim sir but all the same no o was issue no so a wo betimi enso so ehu doctor enti no nyame eye adomo a Saturday sisi ano ye introduce live live worship ewo Good Morning Holy Spirit studio hanum say me adoma Saturday and na year started 12:30 na che say ye day ejina so 12:30 p.m. to 1 na che say eno live worship nko a into free one so e copy 2 no so na eye Elder Jackson so atnas no so e dey ne worship and prayer section no so atwa so pepepe nti say na me ka kire wo no ye bedi etimi be phone lines no so etum a ya share wo page no so obetimi aba so na o prayer request be o testimony be a o pese wo share. You are more than welcome. Say obetimi afresh so and say obetimi asende o comment and so through Rocky's TV ewo Facebook and I say Rocky's One ewo YouTube. Na Sunday so as usual the international hosts abi send da me no Sunday bia me the topics are very educative ebro. Enunti nyankopon hata suwe adomo a kwesi ada biem message medwa na mesade another topic. Enunti no sis Abi